In the meantime, we're going to move on to the other major news this Friday night, the pandemic, and a major change for schools across this country. The CDC issuing new guidelines tonight recommending 3 feet of social distancing for school children with masks instead of 6 feet. So could this help get children back to school sooner? Some teachers' unions are pushing back tonight. The CDC director saying, we have the science. Here's ABC's Whit Johnson.
Tonight, a major change that could help pave the way for millions more children to get back in the classroom.
I'm hopeful that we are turning a corner on this pandemic. Getting our children back to school, in-person instruction as soon as possible is a critical first step in doing so.
The CDC today reducing its distancing recommendation from 6 feet to 3 inside the classroom with universal masking. But if community transmission is high, the CDC advises middle and high schools to break students into small groups or stay at 6 feet. That's because older kids are more likely to spread the virus.
We've seen the science to ensure that this is safe for those schools.
The CDC citing multiple studies finding the shorter distance did not sacrifice safety. Marcy Clark is a mother of 3 in New Jersey whose kids haven't been in a classroom in a year.
It's been a year. I am at peace with my kids returning to school and being 3 feet apart from a classmate.
But some major teachers' unions pushing back. The National Education Association calling for more detail and saying the rule change would be particularly challenging for large urban schools with fewer resources, and concern from some school boards.
We do not want to try to cram, as many students as we possibly can into a classroom.
Today, Joe Biden making his first visit as president to the CDC, saying science is back.
So you've changed things. You've changed them in a way that are going to make everybody healthier in this country. And when we have a crisis, you're prepared to meet it because you speak truth and science to power.
But tonight, an urgent warning. Dr. Anthony Fauci saying the highly contagious UK variant could be 64% more deadly and now accounts for up to 30% of infections in the U.S., but adds the 3 authorized vaccines are effective against it.
Get as many people vaccinated as quickly and as expeditiously as possible with a vaccine that we know works.
And so let's get back to Whit Johnson tonight and back to those new guidelines for school children, a change from 6 feet to 3 feet with masks. But for teachers and adults in schools, we took note that the distance will remain 6 feet.
David, 6 feet is still recommended among school staff, and when teachers are interacting with the students, that distance is also advised in group settings. When kids are eating lunch, exercising, or engaging in other activities without masks. And the CDC pointing out that children between the ages of 5 and 17 make up just 10% of the COVID cases in the U.S. David?
All right, Whit Johnson, Whit, thank you. There was some pushback on this today from some teachers' unions, as Whit reported there, and I'm sure you have questions at home on this. So let's get right to Dr. Ashish Jha, the Dean of the Brown University School of Public Health. And Dr. Jha, always great to have you. You heard the head of the CDC today say that we have the science on this. Are you confident 3 feet instead of 6 feet makes sense?
Yeah, David, thanks for having me on. I think as long as the kids and adults are masking up, as long as there's reasonable ventilation in the room, I think the science here is pretty strong. The 3 feet is every bit as safe as 6 feet. So I think the CDC's really gotten this right.
We're watching the vaccination numbers, too. We're encouraged by what we're seeing in recent days, but we also watched Dr. Fauci defend himself on Capitol Hill this week, still wearing his mask after being fully vaccinated. He said this is not theater. Even for vaccinated Americans, the recommendation is still masking in public because there's still a lot we don't know, even if you've been fully vaccinated.
Yeah, and here's the key part of that. I mean, I think we have very good evidence at this point that getting vaccinated dramatically reduces transmission. But there's still a lot of high-risk people out there, David, who have not yet gotten vaccinated. And so even if there's a small risk of spread, while those people have not gotten vaccinated, I think we need to continue to mask up. Over time, we definitely can get rid of our masks and go back to a more normal way of life, but not until we have more high-risk people really vaccinated.
All right, Dr. Ashish Jha with us on a Friday night. We always appreciate your time. Thank you.